To get us started, for the record, my name is Jonathan Jones, and it is my pleasure and my privilege to be your host and moderator for this afternoon. Someone invited you here to this presentation because they cared a lot about you. And I think every single one of us knows someone or has been impacted by diabetes in some way. That's what started me on the path of health and wellness was diabetes, not my own personal running with diabetes, but it was in my family. My mother had it. And I learned to hate diabetes because of what I saw it do to my mother. And in fact, it was somewhere around 24 years ago today that diabetes is blamed for or credited with my mother's death. Her death certificate says complications of diabetes. So, and was at that moment that I realized that I was in the wrong line of work. My background was computer electronics and engineering. And the intensive care nurse, when I asked her what was she doing for my mom, she said, well, we're monitoring her very closely. I felt like I was doing that. I said, well, what are you doing to change her situation? She says, well, to be honest with you, Jonathan, we're praying for her immune system to kick in. I'm a firm believer in the power of prayer, but we had that covered already. I figured the hospital was going to be doing a little more than that. But they had nothing. And that's what made me aware that there had to be something else. When she said immune system kicker in her, I was determined from that point to never be in a situation where I needed an immune system kicker in or didn't have access to one. And interestingly, it was not too many years after that. Actually, well, no, it was quite a few years because it was right around 2016, 2017, when Jeff Ashby came to my house and showed me something that would change the course, my trajectory from that point forward. And it centered around a patent. In fact, I think I have a picture of it here that I may want to show you. It was this patent right here. Jeff was giving me a presentation about something called military micronutrient formulation. I didn't want to hear about any vitamin or anything else, but out of respect for one of my colleagues who had hit a home run with something else that she told me about, I took the time to speak to Jeff and Helen. And I thank God that I did. Because when I saw this title right here, Micronutrient Formulations for the Treatment of Diabetes Mellitus, that changed everything for me. Because see, the word treatment of diabetes is in the title. And I can't say to you that anything will treat or cure a disease. I'm going to give you the disclaimer in just a minute. I'm not allowed to say that. But if I tell you the title of something, we can tell you that. And that's what Jeff showed me almost 10 years ago now, was the title of this diabetes. And right below it, the inventor there was Kedar and Prasad. And I said, well, I need evidence that this works. I need proof that this works. So Jeff and Helen, they were so confident that this would work that they overnight expressed packages to 4 different people that I knew were brittle diabetics. My sister, my sister-in-law, a couple other people. Every one of them, about a week or so later after they got the product, all said the same thing, that they'd never seen their sugar levels, their fasting sugar levels, as low as they did. That told me that Dr. Prasad was an unusual man, that something was different about this, and I needed to know more about this. So we're going to talk about that a little bit. I believe that there's some of you on here right now that have used the ancestor or the product that has come along since MMF, Micro Daily, and had some good results with your diabetes. I'd love to hear your story here in just a moment. So if you do, and you're willing to share your story right now, we'd like to hear it. But before we do that, just keep in mind, you see the disclaimer here that we are by law required to remind you of is that the FDA is not evaluated. Raise your hand, by the way, if you want to share your story. The FDA has not evaluated these statements. Testimonials that you hear are anecdotal. Results are atypical. That means that what happens to one person may or may not happen to you. Neither the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jonathan Jones, nor any authorized representatives are making claims that supplements that we recommend will treat or cure any disease state. This presentation is for information and educational purposes only. It is not intended to be a substitute for a visit to your doctor. We strongly recommend that you seek the competent medical advice of professionals that you trust. So we look forward to telling you more about this, but I'm just excited to hear, see if there's anyone that wants to share their story right now. So I believe Elizabeth Henry was the first one that raised her hand. So Liz, did you have a diabetes story that you want to share with us here?
It's not my diabetes, it's my sister's. And it's
That's close enough. That's family. So
her son called me last night with a three-way call with his mother, my sister. He says, Aunt Liz, Mama just told me that the doctor says she no longer has diabetes. They have taken her off of metformin. And I said, you got to be kidding, although I knew he wasn't kidding. But it's interesting because my sister has been very bad. Her blood levels were like 600 at one point. They wouldn't even let her come out of the hospital. But a few months ago, I told her children to please give her the Core 4 and make sure she gets it every single day. She lives in Buffalo, New York. So last night, I didn't have any idea I'd get that kind of news, but I've been basking in it all day.
Wow, that's hot off the press, Liz. Thank you very much for sharing that. That is, it doesn't surprise us. We get excited every time we hear it. You know, someone battling with 600, glucose levels is that's unbelievable. And the Core 4 made a difference. So we're going to hear a little bit more about what this product was that Liz gave to her sister, and what they credit with getting these kinds of results. So thank you again, Liz, for being willing to share that story. So how serious is this issue of out of control glucose and sugar levels? It is so bad that there are some scientists who believe that heart disease and diabetes should be classified as one and the same. They believe that diabetes leads to heart disease. Well, diabetes is so prevalent now. We're talking about 1.4 million new cases being diagnosed pretty much every year. Men, higher amount of incidence than women. 53 million people diagnosed with diabetes 18 years and older. In the pre-diabetic category, we're talking 96 million people. These are the most recent statistics. So I probed AI and told it to go and find the most current statistics on diabetes, and that's where we are right now. Do the math, folks. That's nearly 150 million people who are diabetic and pre-diabetic right now. And most of that, of course, is connected to type 2 diabetes. And quite distressing. The economic impact is staggering. If you just try to wrap your minds around it, $413 billion is what it costs to treat diabetes. Now, I'll be the last one to try to imply that when that much money is being generated for the economy, that would be a disincentive to resolve the issue, because I don't want to imply that. So I don't want you guys to go thinking that that's what I'm trying to say. However, the movement of money is good for the economy. Well, right now, because of diabetes, that's more than $400 billion in economic movement of money. And if you count in lost productivity, medical costs and lost productivity, we're talking another $106 billion in lost productivity. That's folks not being able to go to work or for whatever other reasons it may be. But the numbers total out to close to $500 billion is what this dreaded disease is costing. So, and most of that, of course, will come out of insurances and, taxpayer monies and all kinds of things. Now, Dr. Prasad has told us that there's 3 different kinds of diabetes. His patent says this, by the way. If you look back at that patent, if you can look it up, because I went to find that patent because Jeff couldn't just tell me that patent existed. I had to go find it. There's type 1 diabetes. That's where the beta cells in the pancreas don't produce insulin. Type 2 diabetes, that can happen anytime later in life. I just last week, we did a 3-way call with a woman who has type 1 diabetes that was adult onset. I'm going to be sure, I want to ask Dr. Prasad how that happens. But type 1 diabetes, she developed type 1 diabetes about 10 years ago, and she's in her 60s now. So in her 50s, she developed type 1 diabetes. So usually adult onset diabetes is type 2. Then there's gestational diabetes. That's happens sometimes during late stage pregnancy. My mother died from the complications of type 2 diabetes. The risk factors, take a screenshot of this, and you'll see the risk factors for type 2 diabetes. Now, family history, that's what motivated me and my wife, by the way, to start trying to find things that we could do to avoid getting diabetes. But because her father had diabetes, my mother had it, neither one of us wanted to come down with it. So we started searching for alternatives. We want to change our habits. We want to at least improve how we ate because we just didn't want to come down with this diabetes. But obesity, physical inactivity, poor eating habits, all of those things are the risk factors for type 2 diabetes. Now, type 1 diabetes, that's a little bit of a different animal. Type 1 diabetes, family history is still a factor, but sometimes it's injury to the pancreas. And maybe this is what Dr. Prasad will answer the question. If something happens to the pancreas that could cause type 1 diabetes, and maybe that's the key to what happened to that woman, this client, from just a couple of weeks ago who came down with type 1 diabetes. I mean, I told her that it was her beta cells that clearly were damaged, and that's the reason why she has type 1. But then production of autoantibodies. There it is, autoimmune disease. So the immune system starts to attack the pancreas. Exposure to virus, all of this can lead to type 1 diabetes. And the symptoms, just take a screenshot of this, and that tells you what the symptoms are. And we'll get more details on this in just a moment when we bring Dr. Prasad into our discussion. But most of the time, people can tell that they're diabetic. Dr. Prasad described once that, before they invented or discovered that insulin could work for a human, the person who was diabetic would basically just become so emaciated that they would just starve to death because their cells were starving. The glucose wasn't going into their cells. It would look like a person with AIDS. I saw some pictures of that from some, earlier publications showing the history of it. But it was a horrific way to die, a slow, agonizing death. But let's bring Dr. Prasad into our discussion. He's forgotten more about diabetes than I know on the subject. Look forward to hearing his expressions on it. Dr. Prasad was a professor at University of Colorado School of Medicine for some 30 years, director of vitamin and cancer research. He was also a former president of the International Society of Cancer and Nutrition, member of the Royal Society of Medicine, London, UK. He was on the nominating committee for the Nobel Peace Prize in the categories of medicine. He was invited to participate in that. He was the world's first radiation biology PhD. That's a big deal. So don't discount that as being irrelevant. His formulas have been awarded not 8, but some 10 U.S. patents. So we'll make mention to some of those as we go on into our discussion. He is the scientist who discovered that vitamin E succinate is cytotoxic to cancer cells. He's the one who discovered that butyric acid, small fatty acid formed from fermentation of fibers in the gut, is an anti-cancer agent. So put those two discoveries together, and you're talking about someone who knows a great deal about the anatomy and biology of the human body. He knows a great deal about the gut. And the immune system is 80% in the gut. Dr. Prasad knows that. And so one of the contributing factors, as you saw earlier, to type 1 diabetes happen to be autoimmune issues. Again, it begins in the gut. He's the author of some 30, it says 33 here, but I think it's more like 35 books, co-author of 35 books, and he's been published close to 300 times in peer review publications, scientific publications. One of his most recent publications is this one right here. You can take a screenshot of this one, folks, because right now Dr. Prasad is being invited all over the world to give lectures on this subject right here. So, and this is a published paper, peer-reviewed published paper. Prevention and improved treatment of diabetes using micronutrient mixture, probiotics, omega-3, and collagen peptide. So that, I'll tell you, even if we said nothing else whatsoever about Dr. Prasad, that's saying a mouthful right there. When you look at someone who's 90 plus years old, 91 years old, and still writing published paper, and not only has he not lost one neuron at all, they're still firing on all cylinders, and he's still able to produce amazing cutting edge work. So Dr. Prasad, thank you so much, sir, for joining us.
Thank you, Jonathan. I always enjoy working with you and also with my engaged family. I love them, and because of them, we are growing, and more and more new products are coming.
That's right. Lives are being changed, Dr. Prasad, because of your formulas and your brilliance. Tell me something. These lectures that you're giving in different parts of the world on this subject. Tell us a little bit about where it is that you're giving these lectures.
I mean, they invite me, and then through a Zoom call, I do it. Sometimes it is in Paris, sometimes in Portuguese, like last week it was in Portuguese. Sometimes it is in France. So it's different all over Europe. And even now, next year, I have committed to 6 core importance of core 4 in a 6 meeting. And the 6th topic is Alzheimer, diabetes, Parkinson's disease, and cancer, and PTSD. So 5 different places, different topics, different country. And so only time sometimes I had a problem is because 8-hour time difference in European country.
Yeah.
So if they give me early, then I have to get up at 4 o'clock in the morning. So from now onwards, I will tell them that if we do my talk late afternoon, then our time would be 6, 7 o'clock.
Yeah.
That is, I can handle very easily. But one time I did 4 o'clock one, but I didn't like it. So, but anyway.
Don't think I would like that either.
But you know, I enjoy doing it, and many people, and they keep inviting me again and again.
Well, I guess so, Dr. Prasad. We're never going to get tired of inviting you here. I'll tell you that right now, Dr. Prasad. Before you comment on this right here, this because people want to understand a little bit about what diabetes is.
Yes.
And I took this from one of your papers, this screen right here.
Yeah.
You know, what glucose levels are, A1C, and so on, so on. Could you, before we talk about that, could you please explain a little bit how it is that Elizabeth Henry's sister's sugar levels could have gone from 600 down to normal just being on a...
Yeah, here is what happens. Normally, as soon as you eat food, which has a sugar, no matter carbohydrate or sugar, eat food, the stomach sends a signal to pancreas that I need insulin. Pancreas sends insulin to the blood. And then insulin then binds with the insulin receptor, which is on every cell, insulin receptor. And when they bind it, it activates a signaling molecule called AKT. When that molecule gets activated, they send a message to another molecule called the glucose transporter 4 protein. Generally, they are lying in the cytoplasm doing nothing. But as soon as the AKT gets activated, they send a message, you migrate to the cell surface. So then that molecule migrates to the cell surface. And then once they migrate there, then they say, okay, glucose, you come inside the cell to generate energy for these cells. So this is the normal pattern. But what happens in diabetes, the receptor gets damaged, insulin receptor gets damaged. How? Oxidative stress. Once it gets damaged, now it cannot activate AKT molecule. Now the glucose transporter 4 cannot migrate to cell surface, so glucose accumulates in the blood. And that's the reason you have increase in glucose level.
So her glucose levels then being at 600 meant that for quite some time, this
Yeah, because
glucose
it
was
takes
not
time.
going into her cells.
Yeah, because in other words, then she was not doing anything. She was not taking medication or whatever. Or if she was taking a medication, she was resistant to
It
medication.
was,
And so the glucose goes up.
but this it's just mind boggling. So it doesn't surprise you then when you hear when
No.
someone is able
Yeah,
to.
because the individual, they neglected themselves. They said it will be okay. And then keep accumulating. Glucose will keep accumulating. And
Mm.
another thing that when glucose, once A1C gets high, then your oxygen cannot be delivered because hemoglobin is the one who delivers oxygen to every part of your body. And so then if you get tired, you don't feel, energetic because there is no oxygen going on normal amount.
Okay. So that means that the red blood cell then is coated with sugar instead of oxygen.
That's right.
It's
So
got
binds it. So
sugar
now
all over.
oxygen can be binds it and delivers it.
Bad
That's
situation.
bad.
Okay, but tell us a little bit about, just for the sake of definition, then, could you tell us a little bit about what the A1C is?
A1C is a hemoglobin, like in a blood, RBC, red blood cell has a hemoglobin. And one of the major function of hemoglobin is to deliver oxygen because oxygen will bind it with hemoglobin. That hemoglobin goes to various parts of the body and delivers the oxygen.
I
But if
see.
it is bound by another molecule like glucose, then oxygen has no place to bind it. And so now the oxygen cannot be delivered to various tissue
I
because
see.
hemoglobin is so important for delivering of the oxygen to all part of your body. And without oxygen, you can't do very much.
Gotcha. So when you had here that it's the percentage of sugar attached to the hemoglobin,
Yeah,
so the more sugar on the hemoglobin, the higher the A1C.
that's right.
I
Right.
gotcha. Okay, well that's interesting, Dr. Prasad. We have a picture here that this kind of heads toward this whole glucose thing that you were just talking about.
Yeah.
And this is what you were just describing, how
Yeah.
this glucose goes into the bloodstream and the pancreas is what delivers the insulin into the blood to allow it to
Yeah.
go into the cells.
Yeah. Cell, but insulin has to bind it. Yeah.
Mm-hmm.
Right. But if you damage the receptor, it can't bind it. And if you can't bind it, it cannot activate the signaling molecule called AKT. And if it does not happen, then glucose transporter protein remains in the cytoplasm, so glucose cannot inside. They have to go to the cell surface to allow glucose to come in. If they cannot do it, then you are in trouble.
Mm-hmm. That's a real problem. So all this glucose going to these different body parts, that's what causes the eye problems,
Yeah, again,
neuropathy.
increased oxidative stress will continue. Suppose you become resistant or whatever is growing, and then you develop all this eye problem, retinopathy, nephropathy, and heart damage, and all kind of the side effects. And again, these are all related to increased oxidative and inflammation you did not control while you are taking any kind of medication.
Incredible. For some reason, Dr. Prasad, I had not paid attention to this statement in your paper that heart attack and stroke, that
Yeah,
90% of diabetics develop heart attack and stroke. I did not see that.
yeah,
So
yeah. It's true.
what that scientist was saying was correct, because now here's another scientist saying the same thing,
Yeah,
that heart disease and diabetes, they're like hand in hand.
yeah. It is true. It is true. And so I think it is very important to this is the current treatment of diabetes is treat the symptoms. In other words, try to control the glucose. Why glucose is getting elevated causes, they don't treat it. And so what we are saying it, yeah, treat it, but I will say, And then what happens? There are 5, 6 different types of oral medication, and then of course insulin in the end. But the thing is that once you develop resistance to one medication, then they will shift to another medication, which reduces glucose by different mechanism. Then if you, so there are 5, 6 different types of medication. And you will see in my review paper, I have name of those medication. I cannot remember it. But
Yes, yes. In fact,
so,
I'll show that screen in just a minute.
so no question, the disease gets slowed down, but eventually they develop it. And then all the complications that you mentioned, it develop in a lot of people, despite of taking all medication. And then you have sometimes you have to amputation of the leg and this kind of stuff. So they can be all prevented. They can be all prevented. And here's the thing. So okay, go ahead. Do you want to go further, or do you have to say something?
Yeah, no, I did because right here, this is what you're talking about, these current anti-diabetic
Yeah,
drugs.
yeah. Block production of glucose by the liver, because generally, if body needs extra glucose, the glucose liver converts it. So if you block the production, then sugar is not available. Reabsorption of glucose by the kidney, because all it is removed by the kidney, and so they said, okay, you won't be reabsorbed, so you maintain the glucose in your body more. Improve secretion of insulin by inhibiting an enzyme DPP4. This is also, and improve secretion of insulin by inhibiting the enzyme DPP4. And as you know, we have GLP-1, which is very important for glucose metabolism, and DPP4 enzyme destroys GLP-1 within 2 minutes. So
Wow.
until you have inhibitor of this thing, it is not going to work.
So then the current
As I
treatment,
mentioned, current drug treatment have slowed the progression of diabetes type 2. However, diabetic-related complications do develop rather slowly despite taking one or more medication. These drugs do lower fasting blood glucose, no question, A1C, but they do not affect the oxidative stress and chronic inflammation. Therefore, the disease continued to progress rather slowly.
and type 1 diabetes is very similar, same thing.
Type 1. Now, type 1 diabetes is, like I say, causes a little bit different, but only thing here, because pancreas cannot produce it. So that's why type 1 diabetes, the best medication is the insulin right away. No oral medication. Insulin give it.
Right.
And what happens? They become insulin resistant patient sometimes. And even type 2 diabetic patient, if they get tired of oral drug medication, then they end up getting injection. But then still they develop insulin resistance. So then what you do? You have tried everything, insulin resistance, so what you can do? Here what our product Core 4 does. The omega-3 that we have, so what it does, that it directly, not via an insulin receptor, because they're all damaged,
Right.
directly activate the signaling molecule AKT. And so AKT gets activated, they tell glucose transporter protein, you better go migrate into the cell surface and allow glucose to come in. So even at that later stage, the core 4, one of the component of the core 4, omega-3, is so powerful to reducing the
That's a
glucose.
big deal. That's such a big deal, Dr. Prasad, because I don't think, and the last time we had this discussion, half of my team was just blown away by that thought. And I think that if there's anyone new here right now, they need to understand what you just said, that even a type 1 diabetic
Yeah,
If even if insulin is not being effective, omega-3
yeah,
can trigger
yeah.
the opening of the cells to allow glucose to go in,
Come in without it going through insulin.
independent of the presence or absence of insulin. Omega-3 can tell the cells to open up and
Yeah,
let glucose come in.
come in, and insulin is not involved.
That's incredible. That is
So
absolutely so.
I mean,
Every diabetic should be putting omega-3 in their body.
definitely, definitely, because in case you never know, and what you're taking medication, some of them have also side effect. Don't forget that.
Mm-hmm.
And so not only you are preventing the progression of the disease, but also you are increasing the efficiency of all the medication you are taking so that you never develop resistance, their effectiveness will last longer time. And so if you start say metformin and start taking the core 4, maybe you don't need to take any other medications. You see what I mean?
Mm-hmm.
Because you
Mm-hmm.
will never develop a resistance.
Wow, that's incredible.
I mean,
Incredible.
so I think this is so important that people who are metformin in the beginning, that is the beginning medication. If you have diabetes, they will recommend first try this one, and once
Mm-hmm.
you become resistant, then you try this one.
Yeah.
But if you take core 4, then you never go to another medication, or maybe after some time they may say that you don't need a metformin. I don't
That's
know, but
huge.
I'm just saying that
That's
at
right.
least this is a metformin would be very good to have a core 4.
Well, Dr. Prasad, Elizabeth Henry, her sister just was taking off all of her diabetes medication. All she's doing is taking the core 4.
Yeah,
No
you,
diabetes medication at all. So, and
yeah.
there's no
So
side effects to the core 4.
exactly. So sometimes doctor tendency is that even though you are maintaining say normal glucose or A1C level for a long time, they never say that okay, so why don't you just reduce the medication or try
No,
to give up for a week or two?
no, no.
No, they have
Well,
to continue. But
well, they,
it is non-toxic. Metformin is non-toxic in a
Mhm.
way. And some of the recent report suggest that it may reduce the risk of Alzheimer. So if somebody is Alzheimer, I have no problem with taking metformin and in combination with core 4. And if doctor says keep doing it, then keep doing it. If doctor says no, then stop it.
right, right. Well, tell us a little bit about how it is that the collagen peptide can also benefit someone who's diabetic. Because you mentioned this
Yeah, I
before
mean,
about this DPP-4.
this is accidental finding mechanistically. Core 4, I added the amla extract and white tea extract with the intention to reduce collagenase activity, which destroy collagen. That was the main purpose.
Mm-hmm.
Then suddenly I found that somebody was saying that I feel better, more effective GLP-1 boost that we develop if I take with collagen peptide. So I said, okay, let me see if amla extract and white tea also inhibit DPP-4, because that's the one who destroy GLP. And indeed, when I found out, yeah, it's a very small amount, but it do inhibit DPP-4. And that's the reason in combination with the GLP-1, it was working weight loss issues. This
That's a
was
beautiful thing.
accidental. I mean, initially was not there. And then what we have done it now, that we identified another herbs. This was like, for example, amla extract, probably 30% inhibition, not very much. But I found out herbs, very non-toxic in human, and the 100 microgram dose, very small amount, inhibits the DPP for 97%.
Wow.
So the
Wow.
new product that we are the patenting will be called GLP boost with enzyme inhibitor.
Oh, that's beautiful. That's beautiful. So I think
And
folks need
they
to,
will be marketing, I think, within next 3 months or something.
okay, well, I think folks need to understand this, that this product right here, this collagen peptide. Now, one of the previous screens, Dr. Prasad was just talking about, one of the drugs that is commonly prescribed for diabetes is a DPP4 inhibitor.
Inhibitor, yes. That's the
So
approved drug.
that's one of the drugs that does that.
Yeah. But
This
that,
collagen, this collagen peptide has enzyme inhibitors, which just so happens, oh, by the way, is a DPP4 inhibitor.
yeah. And they had no toxicity.
No toxicity whatsoever.
Yeah.
So we're talking already now, we're talking about microdaily
Yeah,
benefits of the oxidative stress and free radicals.
that's
The
right.
omega-3 is
Yeah.
like insulin, it's like a natural replacement for insulin.
Yeah.
And now this collagen peptide is also like a natural replacement for one of the diabetes medications, the
Yeah.
DPP4 inhibitor.
And fourth one is the equally important is the intestinal dysbiosis.
Mm-hmm.
You have number of harmful bacteria increases and number of beneficial bacteria decreases. It is occurring in all diseases, human, including diabetes. And it produces a lot of toxic chemicals, including pro-inflammatory cytokines, which will damage all your cells and increase the rate of progression of the disease. And therefore, you must have a probiotics with prebiotics to prevent the harmful effect of intestinal dysbiosis because they take over and now you have more beneficial bacteria than harmful bacteria if you take probiotics with prebiotics.
So because the immune system is in the gut, it stands to
Yeah,
reason that this probiotic, would
yeah,
be a
that
benefit.
also affects your immune function. Yeah.
That's right. That's right. So Dr. Prasad, the client that we had 2 weeks ago that developed adult onset type 1 diabetes
Uh-huh.
could have benefited from all four of these products.
Sure. Because see, the adult type 1 diabetes, that means he must have a viral or bacterial infection and destroys his pancreas to produce it.
Had to
So,
destroy the beta receptors in the
yeah,
pancreas.
yeah. And so it was not a genetic inheritance.
Right.
It was acquired in a way which rarely happens, but it does happen. In that case, then they treat with insulin because there is no insulin coming out from pancreas.
Mm-hmm.
And then if you combine them with our product, then insulin sensitivity will be maintained for a long, long period of time. And maybe you don't require dose. Sometimes if they become resistant to low dose, then they keep increasing the higher dose. But if you are taking these product core 4 and omega-3 will make sure you have always enough glucose
Yeah.
in your cell and not accumulates in your blood.
Mm-hmm. Mm-hmm. That's excellent. I before one we have a couple of questions for you that came up in the
Sure,
chat.
sure.
One of them is about the omega-3, but I'd like to get some more to see how effective this GLP-1 boost is.
Mm-hmm.
And I know that I asked Jeff if he had any situations where individuals have shown any benefits with the GLP-1 boost. So Jeff, can you chime in on this and tell us what kind of results you're seeing with GLP-1 boost in
Absolutely,
combination with the Core 4?
you bet. Jonathan, this is just an amazing opportunity because so many of our microdaily family members, we only know through the screen, just like what we are doing here this Sunday afternoon, early evening. Well, it just so happens that we are meeting Miss Marka Horn for the first time, and I'm going to share her video. We were doing a Zoom, and she's going to come on and talk about her experience. She had a traumatic brain injury 10 years ago, has been fighting many things, but started onto Dr. Prasad's formulas. And then the GLP-1 boost came out. And so I'm going to just share this with you. And here we are just outside of this restaurant. right there
Oh, wow.
in Houston, Texas. That's where we're
All
going to be.
right.
Marka and her husband in 15 minutes. So this is exciting for me to be able to share with you, because we do get to see and meet our Micro Daily family members. And yeah, let me just have Marka share her experience. And again, this is just a recording of a Zoom that we were doing. So here it is. Here that Marka, you had opened up your camera. If you want to unmute yourself. Love to hear a little more from you. There you go.
Well, as far as eating, I've only lost 12 pounds, but I'm okay with that, because with the brain injury is way better than anything I've been able to lose in the past. And I'm not trying to lose weight, because I always try to find what I lose. So I'm reducing inches and building muscle, and that's all that matters to me, and better health, right? So I am on the brain boost and the heart boost and the probiotic, and the GLP-1 boost. So I just feel like it's important to have the way you eat, more protein. But to me, every day, one thing I have done is every morning I woke up and done hydration, like a hydration, electrolyte, coconut water, something. So to get my, that's one thing I've done different for like 30 days. And that's made a huge difference in the way I feel. But I also have been able to fast a little more, not feeling hungry, but I've just got a much better appetite in a way that I've not had before. And then, like I said, I have that lipedema legs, which and my legs are shrinking. So I'm just enjoying more protein and fiber and hydration. Those are my priorities. But sugar to me is not that's been something as a part of my life, my whole life. And I'm just determined to get my brain better. And so sugar to me is like just completely disgusting and off the table. But I mean, I do have like a little maple syrup or something if I need it, or honey, just a little bit. So I'm just looking at what I'm eating. How is this nourishing me? How is this supporting my goals? And that's all that I'm doing different.
Marka, tell us a little bit about your brain injury. How long ago was that? And how these products have helped you? Tell us a little bit about that.
My brain injury is 10 years old this month. May 28 will be 10 years. But 4 months ago, my brain was only functioning at all parts of my brain under 34%. One part of it was functioning at 1% on a QEEG. And now I'm at 74 and 75%. All my parts of my brain have completely started functioning better. My walking is better. I just feel like I'm going along life more normally now. And this has just like literally happened in the last couple of months. So I'm in love with these products.
Thank you.
Isn't that amazing?
Wow.
Here we are. You asked for a GLP-1 story, but
Wow.
we know that we need to have the basis of that 4-4.
Yeah.
And then we add the GLP-1 in on top of it. And look at Marka. We'll get a chance to meet her, hug up on her for the first time ever.
Wow.
Here in about 10 minutes. But interesting, Jonathan, you say, hey, could you share something today? And that's what we have. And amazing benefits if you're suffering 10 years with a traumatic brain injury and notice in 3-4 months the difference. Wow. Thank you, Dr. Prasad. Yep.
Yeah.
Jeff, thank you.
It's very interesting that you may have heard it last time when we had a training, and about GLP boost. David gave a list of people, what percentage. I think 75 to 80% of the people derive benefit in terms of losing weight and no toxicity, which is very important. So the question is why 20% did not respond? There could be many reasons, but the level of DPP4 enzyme could vary. So
Right.
these people have a much higher level of DPP4, which was not inhibited by the kind of like collagen peptide has it. And so so because of that problem, I said, okay, that will be, let me see if I can find the herbs which can inhibit almost 100%
Mm-hmm.
DPP4. And we found the herbs, which, as I mentioned to you, only 100 microgram, I will inhibit 97% of DPP4.
That's what I'm talking about.
Yeah, so now new product that is going to be marketed in a 3-4 months, whenever they decides, they will have a name, GLP boost with enzyme inhibitor.
Yeah. Well, we're
So,
looking.
Dr. Prasad, before I let you go, there's been people out there that talk about Alzheimer's
Mhm.
being type 3 diabetes.
Mhm.
And because of the way that we're approaching type 1 and type 2 diabetes, do you think that some of Marca's brain recovery, what she's been able to do, is because we're addressing the right enzymes, because we're doing some of these things? Visit with us a little bit about that. And then, Jonathan, I know you're going to bring this home today about the opportunity that we have for GLP-1 boost being on special for just a couple more days. So
Mhm.
anyway, I'll turn it over to the two of you.
Okay. No, for example, Alzheimer, you know that I'm using the energy drink that made it.
Yeah.
Hey, you guys, just really quick. Look
It's
who
good.
just walked up to the van.
Hey,
So-
Dad.
Oh, there she is.
Yeah, hi.
How are you?
I'm well.
Very good. We loved your story, so thank you for sharing it.
Yeah. Well, I just shared the story that you shared with us. So anyway, you guys, this is how fun it is. All right, I'll let you continue on, Dr.
No, I'm saying that, for example, in Alzheimer, beta amyloid protein are produced more than normally. So why it is produced more? Because increased oxidative stress increases the enzyme called beta gamma secretase. This enzyme breaks down large protein molecule APP into beta amyloid. So the more the enzyme activity is, the more beta amyloid are produced. So this is what happens. But culprit is the increased oxidative stress. So if you block it, they can't produce enough the beta amyloid protein to cause Alzheimer's disease. So that's one step, how our microdaily can help. Second step is that suppose you have already a lot of beta amyloid and causing damage. So how they cause damage? To kill neuron is by producing free radicals. So you can have a lot of beta amyloid there, but if you block the free radicals production, then you don't have Alzheimer's disease. So you can see you can affect several steps. But if you start earlier, then you don't develop it. Even if you
That's
later
right.
stage.
That's right.
And so this is very important to remember how important is core 4. And of course, all these things that we mentioned, the intestinal dysbiosis, omega, and collagen peptides. These 4 not only help that one, but will help almost all diseases that I mentioned, major neurological diseases, and even diabetes in cases.
That's
Which is
right. That's right. Well,
because in all diseases, increased oxidative stress and inflammation is the culprits.
that's right. That's right. Understood. Completely understood. That makes perfect sense too. It makes it very, very clear. We're going to tell folks about the special that Engage has for this month, but could you answer one question now? Someone was asking about this is the omega-3, by the way, for everyone who's on attending on our program right now. Dr. Prasad's specific formula for omega-3.
Yeah.
He made sure that the correct ratio of the components are here.
2 to
So
1, yeah.
less omega-6 and more of the necessary important omega-3, the correct amount of GLA, correct amount of DHA, correct amount of EPA. So this is, and all from wild-caught sources.
Yeah.
So this is what Dr. Prasad was sharing. But the question came up, Dr. Prasad, was about this AKT. The person asked the question, does the omega-3 open up the insulin receptors, or does it affect the cell independent of the insulin receptors?
No, it doesn't open up insulin receptor at all. It directly activates by some special mechanism that is nothing to do with insulin receptor at all. It directly, without involving receptor, it does it.
Okay. So I hope that that's real clear for the question. Bernard made sure that the question came to the fore. So this AKT signaling pathway tells the GLUT4 to go to the cell surface to allow glucose in.
Yes, that's right.
So it does that independent of insulin receptors.
That's right.
This is huge, Dr. Prasad. This is huge.
I know. Because insulin receptor is damaged, so it can't do anything with that one.
Wow.
That's why it became insulin resistant.
Yeah.
Because the insulin receptor is damaged.
So type 1 diabetics, listen up. Professor Prasad, add omega-3 to your diet. Now, I did some research, Dr. Prasad. It said that basically between 6,000 and 8,000 is the maximum amount of omega that a person should have. So then basically someone could take 2 capsules in the morning and maybe 1 or 2 throughout the day and maybe 2 at night before they go to bed, and they still will be within the safe range.
Yeah, it is non-toxic.
Mm-hmm.
And if you take a 2 or 4, it doesn't make difference. It won't hurt you. So if depending upon how serious your problem is, if it's a beginning one in the morning, 1 in the evening is sufficient. But if you have advanced stage, then you can eat
more
in the morning, 2 in the evening.
Mm-hmm.
No.
That's beautiful. That is beautiful. So that's wonderful. Well, there you have it, folks. So the recommendation then is to the Core 4, along with the GLP-1 boost product, and that is your ticket for those who are dealing with any kind of diabetes type of issues. And
another point I want to mention, one more point I want to mention, Jonathan.
Mm-hmm.
But sometime in advanced stage of the disease, like Alzheimer's, Parkinson's disease, they develop a abnormal behavior. They get agitated. They get hallucination.
That's right.
Anxiety, depression, and so on. And so, how do you treat them? One and only way would be the CBD daily, or CBD, our CBD. CBD is again non-toxic, non-addictive, and so important for those people, even for younger people, who for some reason you have anxiety, depressions. You can help very, very much so. This is a very well-known, well-established, and clinically tested, no toxicity. Another thing, it is the only one that FDA has approved drug.
That's right.
And to be given to children with epilepsy at a dose of 750 milligrams.
Which is about half the bottle. So it's so non-toxic that half the bottle can be taken at once, and it was still safe.
So generally we recommend, take a 2 capsules in the morning, 2 in the evening for a normal person, and they are doing very well. But again, this is one of the things that not many people understands it. And there are mechanisms, and I will talk at some point why it does so like that.
That's right. That's beautiful. In fact, you mentioned before that it was a serotonin reuptake inhibitor. Is that what you said?
Yeah, serotonin reuptake inhibitor, not only that, but it also increases the synthesis of the serotonin. It also increases dopamine so that you feel happy. It decreases the level of glutamate because excess glutamate, if you are released, you become hyperactive and so on. So it does a three major role of one molecule.
Wow, that's absolutely beautiful. Well, I tell you, folks, we can't say enough about these products, and the CBD Boost. I make sure that I have that at all times. My wife loves it.
I take it myself every day.
I think it's an absolutely phenomenal product. There's no question about it. For those of you who are thinking about who were paying attention to what Dr. Prasad said about the GLP-1 boost, now is your chance. We have until just a few more days. In fact, just till the 18th, and only till Tuesday, to get this flash sale on the GLP-1 boost. This is a big deal. This is what Jeff was just talking about, that Marka had benefits from. Flash sale is going on right now. It's a BOGO. So you buy two. Well, it's not really a BOGO. It is. You buy two and you get one free. So buy two, get one GLP-1 boost. That's a major discount. It's like saving $120 right there. So this is the time to go ahead and snatch it up. So a diabetic especially can add this to their regimen, because this behaves just like Ozempic in the body. I asked ChatGPT to explain how Ozempic works, and it broke down the whole thing about GLP-1, semaglutide, blah, blah, blah. But it also told a ton of side effects. I mean, it was like 2 pages of potential side effects, common and some rare side effects. And then it offered to give me a side-by-side comparison to a semaglutide product like GLP-1 boost. I said, okay, yeah, give me comparison. And basically it was thrilled that GLP-1 boost didn't have any of the side effects that the Ozempic.
But you know why those products have a side effects?
Why is that?
Because the protein peptides, which is about 31 amino acid long polypeptide, are derived from the venom of Gila monster.
Oh my goodness.
Venom. They have a venom somebody long before all this thing developed, they were fellow who isolated it, and they found that it reduces glucose metabolism, and helps diabetes, and it was approved by the FDA.
Oh my goodness.
And then somebody synthesized that one. I said, oh, it has 39 amino acid, and then somebody's removed it some more amino acid, and then, for example, Ozempic or semaglutide, these had about 31 amino acids, peptides, but nobody have tested the toxicity of peptide alone. And this peptide act as an agonist of a GLP-1 receptor when it binds with the GLP-1 receptor. But our have a natural product who binds also with the receptor and produce GLP-1.
So there you go, folks. The GLP-1 boost is the way to go. Make sure you're taking it right along with the collagen peptide because of the DPP4, the enzyme inhibitor, components of it, and you'll see the benefits of it. So,
yep.
Dr. Prasad, once again, sir, we can't thank you enough. We're at the top of the hour right now.
Okay.
And
thank
it
you.
been absolutely wonderful to hear your expressions and to have a chance to do this part 2 of our Diabetes Awareness Month. I would like to see a major impact on diabetes, and I just thank you that you have done so much to slay that the dragon that I want to see slayed, diabetes. So folks, remember to don't expect a pill, potion, or lotion to do for you what you can do for yourself. Get yourself moving. Change your relationship with your couch, get those steps in. We cannot say enough about the benefits of physical activity for you and your health. You have control of that. There's something that you can do about it. We strongly recommend that you seek the competent medical advice of professionals that you trust when it comes to making decisions about your health and well-being. So please make sure that you do that. Testimonies that you heard are purely anecdotal, and the FDA has not evaluated any of our comments. Next week, you can expect to have a beautiful discussion with that's the wrong calendar. Sorry about that. I have to delete that one. So look forward to Jeff Ashby next week, and he'll have a very interesting discussion as well. Folks, you can go ahead and unmute yourselves and let's say goodbye to Dr. Prasad. Dr. Prasad, thank you very much again, Elizabeth, and all the rest of you who commented.
Thank you, Dr. Prasad. Love you, love you, love you.
Thank you, Dr.
Appreciate you very
Prasad.
much.
Thank you, Jonathan.